rheumatoid arthritis patient. Now I would like to share a few photographs of our patient which were included in the study. Young girl with a long-standing disease. The slide shows multiple hand deformities. Patient 2, that is middle-aged woman, mother of 6, who does not respond to any DMARD. The slide shows one knee replacement. Patient 3, who is a known case of osteoporosis and hypertension. The slide also shows multiple hand deformities. In the end, I would like to thank Dr. Azra Arif Ali and all the other rheumatologists. Without them, this study would not have been possible. Thank you.
Thank you, Dr. Ambreen. That was a very nice presentation despite the electricity going off. For the next presentation, I would like to invite Mrs. Aisha Gufran, who's a specialist rheumatology nurse at Pakistan Institute of Medical Sciences, Islamabad. And she's going to talk about the role of a nurse specialist, particularly about the biologics experience in Pakistan. We as physicians all know that without nurses and our paramedical staff, we actually would not be able to do even a quarter of what we do for our patients. So it's a pleasure to have Mrs. Aisha here for this talk.
Thank you. Thank you. Assalamu alaikum, ladies and gentlemen. Today I am going to perform role of a specialist nurse in modern rheumatology. As we are talking about the rheumatology is going to change day by day, and we are apply new technology in this rheumatology. So the role of a nurse specialist is also going to be changed, and there are more roles are included in this rheumatology nurse. So the talk is about the concept of holistic care. So before proceeding, I would like to talk about the routine that is going to be in the rheumatology department. When the patient comes to the doctor, the examination including subjective and objective data is taken by the asking patient some questions about what brought you to the hospital, how long have you been suffering from this problem, where does it hurt, and what is the most painful time, relation of pain with activity. So after the asking these questions, the assessment included, and the assessment is painful areas are assessed to check whether the pain is due to inflammatory or non-inflammatory process. And the routine includes diagnosis of the further diagnosis and the further investigations, treatment, laboratory tests needed to be done before next visit, and date for the next visit. This is the routine that are being following in rheumatology department at PIMS. So at the end of the day, what is the patient outcome? Patient may be satisfied, and if the patient is satisfied, then compliance rate will be increased automatically. And if the patient is not satisfied during the process of examination and assessment and the treatment plan, so there will be a non-compliance. So here comes my role. My role is include to improve compliance and provide better care with the implementation of advanced concepts of